So a little bit about my friend Tony here. I'll give you his official bio. He's known as America's holistic plastic surgeon. Anthony Youn, MD, F.A.C.S. is a nationally recognized board-certified plastic surgeon. Recognized as a leader in his field, he is the author of the best-selling books, The Age Fix, A Leading Plastic Surgeon Reveals How to Look 10 Years Younger, In Stitches, a Memoir. His public television special, The Age Fix, with Dr. Anthony Youn, has been viewed by millions. I didn't know about that. He also hosts a popular podcast, The Holistic Plastic Surgery Show. His new book, Playing God, The Evolution of a Modern Surgeon, details his humorous, heartwarming, and often harrowing journey to become a leading plastic surgeon. He is an assistant professor of surgery at Oakland University, Beaumont School of Medicine. It's always fun reading people's bios. I've never said the words before. So let's start off talking a little bit about your book that's just out. It's definitely an entertaining story. To me, it's interesting because I did not have the kind of medical training you did to kind of see it from your eyes and, and the people you helped and the lessons you learned. I guess I would ask, and I think I've even told you, I had some misconceptions about MDs and plastic surgeons and I sort of had some prejudices, but it was really nice to see, you worked your butt off and you helped a lot of people. So what would you like, people to kind of know about, where I'm getting at? What would you know that's not true from what they assume?
Yeah. So, there is this saying in surgery, to cut is to cure. Another one is the only way to heal is with cold steel. And these are sayings by doctors that I trained with. And it really definitely describes the old school medical establishment and the idea that going to surgery is the pinnacle. And doctors look at themselves that way. And, who's the cream of the crop of the doctors? It's the surgeons. And of those, what surgeons are they? It's the thoracic surgeons. It's the cardiac surgeons, the transplant surgeons. And the funny thing, Bridget, is when I was growing up, that's what my dad wanted me to be. He's like, you're going to be a transplant surgeon. And I figured out very quickly that I'm not made for that. That is not me at all. And the book really describes the journey. How does somebody go from being trained in this old-fashioned, old-school surgery curriculum and this, surrounded by this mentality, to becoming a modern surgeon? And the doctors today are very different than they used to be, and we demand that. Our patients demand that. And there is a gradual phasing out of these old-school paternalistic type of doctors who believe that, that they are the be all end all, that they're the source of all the important information. And you and I both know that, doctors, as much as we need to admire them and respect them and understand where they're coming from, don't know everything about everything.
Because none of us can. Yeah.
No. And that's where getting information from people like you on things like nutrition and on environmental exposures and all these things that can lead to chronic disease. It's so, so important today.
Yeah. So you said modern surgeon, and they are sort of we're moving away from this old school idea. So how would you define the new school of the modern MD?
Yeah, the new school doctor understands that he or she is not this God figure that's lording over everybody else, but is a part of the team, the healthcare team, to help the patients. And oftentimes a doctor is a leader of that team and must be the leader of that team in many instances. But is in a partnership with others, whether it's nurses or physical therapists or physician assistants or nutritionists, health coaches. And we're part of that team where the goal is to help the patient above all else, really. A modern doctor does not cut first. It's not to cut is to cure, but you use that and surgery as a last resort. And that's something that I try to preach to my patients and all my followers as well.
So you are a plastic surgeon. You went into private practice eventually, which it sounds like was pretty scary to start that up. I was like, yeah, I can understand. I had my mini version of it, which was so scary, but yours was on like such a bigger scale. So it must have been really scary. So if people are coming to you and you're like, I have this issue, I have that, I want plastic surgery, do you try to lead them into some other directions first? Or do you just do things like do the surgery, but like also layer on nutrition and stuff?
Yeah, so I mean, I turn down 1 out of every 5 people who come to see me because either they're not a good candidate for it, maybe the surgery is not right for them, or maybe they have unrealistic expectations. You know, I tell you, Bridget, right now there are so many people, so many young people that I think are being influenced by social media like Instagram and Snapchat to go to plastic surgeons' offices like mine and to request procedures that they just don't need. And it's sad because I can't tell you how many just beautiful 20-something-year-old men and women come to see me who are profoundly dissatisfied with their appearance.
Oh, yeah.
And they think that plastic surgery is the solution for them, which it just isn't. And there are even studies now that show that people who are on social media when they're younger, you know, young women get on social media, that they have self-image, more issues with self-image as they get older. And we have studies that are showing that even when you take selfies, that it's not reality. One interesting study that came out recently is that if you take a selfie, so you have your phone about a foot away from your face, you take a picture of your face, and then you take the same phone and you take a picture of yourself from 5 feet away, that your nose is actually 20 to 30% larger looking in the selfie. So a selfie photo actually is almost like a Carnival Funhouse mirror version of yourself. It's not realistic. And so people are looking at their pictures and they're saying, geez, my nose is too big, my jaw is too small. In reality, once again, all this isn't necessarily reality because the selfie camera just doesn't work that way.
So interesting. And yeah, you're right on like the forefront of like what's going on with our culture. I bet you notice other trends too. Like, I don't know if people wanted bigger boobs before, smaller boobs now. I don't know what people want, but like, I'm sure there's trends you see just from that kind of a thing.
Yeah, but I think the most important trend is that patients and the public now are doing research on their own. You know, they are learning more. They're becoming their own advocate. You know, that the days of the doctor telling you do this, do that, do this, and even withholding information from you for your own good, you know, I guess in air quotes, that day is over. Although there are still doctors who are doing that. There's still doctors who are glorifying going under the knife. Less and less, I think, as time goes on, are we going to see that? And that's the hope.
Okay. Well, yeah, let's talk about some methods you use, either that are like non-invasive or just in routines. I know you have some of your own beauty products, which I haven't tried yet, actually. I might need to
I got to get you some.
get in on that. Yeah. And I do like microdermabrasion. I think you guys do that at your clinic, right?
Yep.
I love that. It's so, simple. And yeah, I'm a big fan of skincare. I'm like, I have seen an esthetician every month, it adds up eventually, but it's cheaper than surgery. And
I can tell because you always look great.
I always look great, but you did call me out once that I was using my Zoom filter. You're like, you don't look that good.
I didn't say that specifically.
You didn't say that specifically, no. But I like my Zoom filter. It just kind of evens everything out. Yeah, tell us some of the procedures or routines you like.
Yeah, so I mean, the first thing, it always comes down to taking good care of your skin and using the right products. You know, you talk a lot about food and all that, so I'm not going to cover that because your people know all that. But clean skincare is a big deal. There are thousands of potentially dangerous ingredients in skincare products nowadays, ranging from hormone disruptors to potentially carcinogenic agents. And so it's really important for you to know what's in your skincare, to go ideally for skincare products that are made with natural and organic ingredients, and to avoid certain things such as oxybenzone. That's something that's seen in sunscreens, as well as octinoxate, parabens, phthalates, so much out there. But if you're really looking at, once you've got the products, really what I recommend is something that's very simple. It's called a 2 minutes, 5 years younger skincare routine. So every morning, what you should do is you should cleanse your skin, use an appropriate cleanser. So if you've got oily skin, then a foaming cleanser is usually good. If you've got dry skin, then more milky type of a gentler cleanser usually works better.
Okay.
After that, you want to apply an antioxidant serum.
Mm.
The most popular are vitamin C serums. Most skincare companies have their own version of vitamin C. Studies do show that if you combine vitamin C with vitamin E, you can actually get a synergistic effect. So ideally, if you can combine the two, we have one in my skincare line called CE antioxidant serum.
Okay.
And so combining the two, what you're doing with the antioxidant is you're protecting your skin from free radical damage throughout the day. So you want to protect your skin in the morning. The morning skincare routine is all about protection.
Okay.
After the antioxidant, then I recommend applying a sunscreen, once again, avoiding oxybenzone and octinoxate in your sunscreen. Ideally, an SPF of 30 is what I recommend.
Okay.
Now, that's all you have to do in the morning. Well, you cleanse your skin and then you protect it. At night, that's when you really treat it. That's when you want to do the anti-aging stuff. So at night, you want to start with, once again, with the cleanser. Super important. If you wash your face once a day, only once a day, then you got to do it at night because you got to wash off that day's worth of grime and pollution and oil and dirt. So wash your face that night, and then you want to apply an anti-aging cream, usually a type of moisturizer. The one that I recommend and the one that's most scientifically proven is a retinol moisturizer. Retinol is a form of vitamin A, scientifically proven to help rejuvenate the skin by thickening the dermis, which is the deeper layer of skin, by exfoliating the skin, and by help mildly reducing age spots as well. So kind of evening out the pigment. If you want to apply a more moisturizing cream after that, you can, but you don't have to. So if you've got oily skin, then you don't need to apply some. If you've got dry skin, if you've got real mature skin, postmenopausal women, oftentimes they find their skin gets a little drier after menopause, then feel free to add a more moisturizing cream after that. And that's all you have to do each day. In the morning, you cleanse, antioxidant, sunscreen. At night, you cleanse, retinol moisturizer, and then another moisturizer if you want on top of that. And then 2 to 3 times a week, if you've got normal skin, exfoliate your skin. You can do that with an exfoliating scrub. You can make one literally with sugar and some other ingredients. You can do it with chemically, with a chemical exfoliant. You can buy those at department stores, or you can even use like a Clarisonic type of a brush, which can also exfoliate your skin doing that manually or mechanically.
I have a Clarisonic. My esthetician got me into that. And if I do it, I mean, this might be more than you recommend, but like I have oily skin and my skin is best when I use it every single time I cleanse.
Just
I don't
be careful because sometimes it's a bit much for people. And there's some people that I have talked to where they have used it every day and they end up getting breakouts because it's actually too aggressive sometimes.
Oh, okay.
So,
well, maybe it's good I don't remember every day, but no, I think for me, it is generally good the more I use it, like if I'm really consistent, but yeah, we're all different. That sounds very reasonable.
I think it's also important too, if you are using a skincare routine, you've been using it for a long time and you're just finding that you're not happy with your skin, it's good to change things up every once in a while because there are, the skin does get used to these ingredients, and changing up every so often is something that I think helps a lot of people.
So in reading your book, it doesn't sound like you were getting this education as a young surgeon. How did you go back and learn this stuff about skincare?
Well, so when I went through, and I did 5 years of residency, 3 years of general surgery, 2 years of plastic surgery. I spent a year out in Beverly Hills with the top plastic surgeon out there. And I got literally zero skincare education and almost nothing regarding nutrition. So I could write orders for a patient in the ICU to get tube feeds and that type of thing. But then after writing that, I would go to the cafeteria and eat the deep fried apple slices and the deep fried mozzarella sticks and all that type of stuff. And unfortunately, that's endemic in medicine. We go to my conferences every year, plastic surgery conferences, and a lot of times they'll give us this box lunch, which is typically like a turkey sandwich on white bread, a cookie made by some massive company, and it's just filled with trans fats and stuff, and chips. And this is pretty typical. So we have a long ways to go. So I've learned a lot from people like yourself and from our good friends in the holistic health space. I've read so many of their books to educate myself as well.
Awesome. Yeah. And it's so important. And yeah, I think that's great. You offer different opportunities. I'd like to hear a little bit about your other book, because I think I didn't know you then when the H.F.A.C.S was coming out. So I should get it, and just tell us more what we can find in there.
So the H.F.A.C.S is a book that what I tried to do is write a quote unquote Bible of how to look younger. And so what it does is it goes over, there's a chapter on food, and so general guidelines of what to eat to look younger. There's a chapter on the best skincare regimen to use. And there's also chapters on non-invasive and minimally invasive treatments and ways to look younger. And in that book, what I do is I actually recommend various brand names of other companies' products that I have tested out personally that I have liked. And I've also, I do discuss a little bit of surgery as well as other, common treatments. The next thing that I'm coming out with, hopefully within the next year or two, is going to be even more holistically minded and really focusing on the cleanness of the skincare, really focusing on the diet aspect, and even bringing in some fasting in with it and more
Nice.
goodies. Yeah.
Our community will eat that up. And we do need to know this stuff. Sometimes people are a little afraid to ask for information about looking younger, but it really hurts us to feel like we're aging quicker than we want to, right? And we do need to know about options.
Yeah, and it's funny because it's you and I were such good friends with so many people in the holistic space, and we go to meetings and we see a lot of the same people, and so many of them who are leaders in holistic health, who are talking to you all about the right foods to eat, environmental stuff, they get Botox.
I have seen some of that.
Some of them have breast implants, and it's like there's so much of it. It's everywhere, and I think it's part of it's being honest, and it's hard because when you are a leader and people are following you, and it's. So I think in the end, it comes down to none of us are perfect. We all love the idea of feeling good about how we look. And it can be as simple as, you go to the store and you buy a new shirt and you put it on and you feel good sometimes. Just the fact that you've got something new and you walk out and you feel good, there's something to be said for that. And so, yeah, you can do that by microdermabrasion. You can do it by intense pulse light, IPL, and non-invasive treatment. There's so many options short of surgery that we can offer nowadays. So it's a very, very exciting time for people who don't want to go under the knife, but still want to look great and want to fight aging every step of the way.
Yeah, like in my opinion, if you work on health from the inside with nutrition and relaxation, getting a good night's sleep, all that stuff, plus you take really good care of your skin and do some basic treatments on the outside, to me, it's like a great combination, and just staying hydrated and that kind of a thing. Since I have you as my captive audience, I want to ask you about a couple of procedures I've thought about or heard about. One is, I think, called just the hydrofacial or hydrofacial. What's that about?
So the hydrofacial is a pretty popular treatment. It's basically multiple. What it does is it hydrates your skin by flushing these various different mixtures onto your skin. So antioxidants, growth factors, peptides, that type of stuff. And really what it is just a very moisturizing, hydrating facial. I don't know how better to describe it, honestly, than that. It is something where you walk out and your face and your skin feels dewy and moisturized afterwards. It's not a real aggressive anti-aging treatment, so it's not something where you have any downtime. It's very comfortable. So I think it's very popular with plastic surgeons because it's something that doctors buy. It all comes in one kit, and it's very simple to do it. You don't have to learn a whole lot of the intricacies of this patient needs this patient needs that. And it works well. We don't have it in my office. I actually considered getting it. I haven't picked it up yet. I also don't want to be the last guy on the block that buys something. So I don't know that I'm going to carry it, but I've heard a lot of good things about it.
It might trend out. Yeah, I want to try it. Another one. Yeah, I've heard. I had one of my supplement reps used to be like an esthetician kind of rep, and that's what she does.
Yeah.
PRP injections or facial. Do you do any of that or?
So PRP, platelet-rich plasma, is where you draw blood, you spin the blood down, you remove the platelets, which are rich in growth factors. And so there are a lot of ways to use it. In cosmetic surgery, we're using it in a number of different ways. One of the most popular ways to do it is to inject it into areas of the scalp where you have lost hair. and it appears to be quite effective for hair loss. It is temporary, so it's not something where you inject it once and the hair grows back and you never need to do it again. Most people have it done a couple of times a year.
Okay.
But it does seem to help to cause hair to go into a growth phase. So another way to do it is by doing microneedling. When you do microneedling, basically what you're doing is you're making hundreds of tiny little punctures onto the surface of the skin. These punctures are anywhere from 1 millimeter to 2 millimeters deep. And then if you apply the PRP over the surface, the PRP ideally then seeps into those tiny little puncture holes, gets into the deeper skin, and helps to rejuvenate the skin from the inside out. So that's a great way to also, it's a very simple, nice way to rejuvenate the skin. I use PRP all the time when I do facelifts, and I do a lot of facelifts. You know, that's when you've got so much loose skin and jowling that nothing else really will work but a facelift. And what I do is I take PRP and I actually spray it on the inside once we lift the skin and pull back.
Oh my gosh.
And I find that it helps to lower the risk of bleeding, decreases bruising, decreases swelling.
And it's the patient's own blood drawn and then you extract it?
Yep.
Okay.
Yeah. So it's pretty simple. You just draw about 40 cc's of blood. You put it in a centrifuge, just spin it down, you mix a few things in with it, and then you basically just pull out this clear yellow liquid, like the color of urine, but a little bit thicker. And you can use that basically as a spray.
Oh, really interesting.
Or as an injection. Yeah.
Okay. I know my current esthetician does microneedling, but then she puts in some kind of serums, which I'm not really sure.
You can do that too. Yeah, we have one that we do called Tensage. That's a growth factor. I'm trying to remember. I think it may be from snails. I'm not sure. I forget. But that's an option for people who don't want to deal with vials of blood and that type of thing.
Okay. Well, thanks. Yeah. Thanks for that. I know you got to go soon. So let's share more about your resources. For people who want to see you, you're in Michigan. What city are you in? Detroit?
I'm outside Detroit. Yeah.
Okay. So people can, if they're interested, just schedule a consultation or whatever.
Oh, yeah.
Okay. Awesome. So your site is dryoun.com and we'll share that. And there's a free gift on your site. Could you describe that?
Yeah. So I have, it's basically an edited chapter of my book, The Age Fix. So it's What to Eat to Look Younger. It's a free ebook. We also are giving out a free ebook, 10 Things Every Plastic Surgery Patient Must Know. So if anybody's considering any type of cosmetic work, it's a great way. It's a great free resource to read just to get you started. There's a lot of information out there, a lot of misinformation, and you really want to make sure that you go to a trusted source, because really plastic surgery is a wild west of medicine, Bridget, and there are so many people out there doing stuff that they shouldn't. So many people getting botched and people even dying from surgery. So you just got to be careful.
Yeah. It seems like something you really don't want to skimp on or try to save a buck.
Not a good place to get Groupon deals, plastic surgery.
Did they do that?
Oh, yeah.
Oh, I didn't know that. Wow. Well, yeah. And I always tell you this, but I'll tell everyone, like, Tony's just such a nice, like, kind, present person. So if you're going to trust somebody to cut you open or just tell you the truth, like, he's definitely the guy to go to. And yeah, he's just been soaking up all this information on natural medicine too, which is amazing. And I'm really looking forward to your new book. That's great. But yeah, I should go get your old book as well. And I put that here in the chat on Zoom, but I'll go put it in Facebook too. And we'll have it in the notes on YouTube. Any last words, Tony? No, I appreciate it. And if you're interested in learning about the journey of a modern surgeon, check out the new book. Thank you. This is the brand new one, just 6 weeks out. And it's just a really nice memoir of, a doctor's journey. So well, I love what you're doing, Bridget. And we miss seeing you every 3 months. So yeah, I get in when I can't. Someday. I get in when I can't. Yeah. Thanks for everyone for attending. And thanks again, Tony. Good to see you again. Thank you. Bye. Thanks. Bye.